Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How to identify and treat fibroid pain. Uterine fibroids are a very common gynecological condition that can cause pelvic pain and heavy menstrual periods. Fibroids are non-cancerous tumors that grow in the walls of the uterus, womb. /r/n/r/n Fibroid pain feels like pressure, heaviness, or a dull pain in your pelvis. Where you feel fibroid pain depends on the location of the fibroid, its size, and your anatomy. A very large fibroid can also cause low back pain, bladder and bowel problems, and painful intercourse. /r/n/r/n This article discusses fibroid pain and other symptoms. It also explains how fibroids are diagnosed and treated. /r/n/r/n 991, Getty Imagesrnrn A. Fibroid is a benign tumor made of muscle cells, myocytes, and collagen that can develop in different areas of the uterus. They can appear as a single tumor, or you can have multiple fibroids at once. /r/n/r/n Fibroids, also called myomas or leiomyomas, commonly develop on the inside of the uterus. They can also grow on the outer uterus, known as pedunculated fibroids, which are attached by a stalk. /r/n/r/n Fibroids can be as small as a grain of rice or bigger than a baseball. Fibroids can be symptomatic or cause no symptoms, asymptomatic. /r/n/r/n Each fibroid has a unique life cycle. Some fibroids develop slowly, while others grow rapidly. Fibroids typically break down, degenerate, on their own over time, but new ones often develop. /r/n/r/n Up to 70% of women will develop at least one fibroid before menopause. Factors that increase the risk of developing fibroids include /r/n/r/n Uterine fibroids can cause symptoms related to bowel and bladder function, abnormal menstrual bleeding, or abdominal, lower back, pelvic, or groin pain. /r/n/r/n A. Fibroid's size and location can affect how much pain it causes. Large fibroids can compress or irritate nerves, obstruct the bladder or bowel, or cause pelvic pain, pressure, and bloating. /r/n/r/n Researchers estimate only about 30% of people with leiomyomas will seek treatment for fibroid pain and other symptoms. /r/n/r/n Fibroids do not always cause pain, but when they do, it may feel like /r/n/r/n The exact location and degree of pain will depend on its size, where it is in your uterus, the number of fibroids you have, and individual pelvic anatomy. /r/n/r/n Fibroid pain can be cyclical, worsening during your menstrual period, or occur all month. Other characteristics of fibroid pelvic pain include /r/n/r/n Fibroids can also cause sharp, acute pain as they degenerate. Typically, when this occurs: /r/n/r/n Pedunculated fibroids, which grow from the outer uterus on a stalk, can also get twisted during sudden movements, causing severe pain. /r/n/r/n In rare cases, a spontaneous hemorrhagic infarction, blockage of blood supply, of a fibroid can occur. This is known as red degenerate and is more common during pregnancy. Pain from red degeneration can be sharp, severe, and constant abdominal pain. /r/n/r/n Abnormal bleeding is a common problem with fibroids, even small ones. In particular, submucosal fibroids, which grow just beneath the uterine lining, are linked to changes in menstrual bleeding. /r/n/r/n Fibroids can affect menstruation in the following ways. /r/n/r/n Fibroid pain is often felt in the lower back. When this happens, it often flares up when you have your period and can feel like menstrual cramps in your lower back, a general aching sensation, or stiffness. /r/n/r/n fibroids that are large or on the back of the uterus can irritate nerves in the pelvis and cause radiating pain down the legs. /r/n/r/n depending on their location and size. Fibroids can also produce bowel or bladder symptoms, such as /r/n/r/n difficulty passing urine can lead to urinary tract infections as well. /r/n/r/n depending on their location, fibroids can also lead to painful intercourse. This is more common with large fibroids in the lower part of the uterus. /r/n/r/n it was long believed that fibroids could increase the chance of miscarriage because they distort the shape or size of the womb. This, in theory, could affect embryo implantation or trigger uterine contractions. /r/n/r/n However, a high-quality study published in 2017 put that old wives' tale to rest. It found the presence of fibroids did not increase the chance of miscarriage. /r/n/r/n The first step in addressing fibroid pain and other symptoms is to visit your gynecologist. /r/n/r/n They will need to rule out other possible conditions that could be causing your pain, such as endometriosis and adenomyosis. These conditions, which have symptoms that overlap with fibroids, can only be definitively diagnosed from surgery with biopsy and pathology. /r/n/r/n To definitively diagnose you with fibroids, your doctor will consider your personal health history, symptom profile, and family history. They might use imaging tests, such as a transabdominal or transvaginal ultrasound, as well. /r/n/r/n Pain caused by fibroids can significantly affect a person's quality of life. In one study, over half of the participants with fibroids reported that their symptoms negatively impacted their life, including their sexual life, performance at work, and relationships and family. /r/n/r/n It's important to talk to your doctor about medical treatment for fibroids. There are also some things you can try on your own that might help you manage your symptoms. /r/n/r/n There is not much evidence to support home remedies specifically for fibroid pain, but you might find that they offer some relief. To help manage fibroid pain, try /r/n/r/n These techniques will not alter or cure your fibroids, but they can help change your perception of pain and correct muscle imbalances that develop due to pelvic pain. /r/n/r/n Other lifestyle changes that can promote your overall health and may help relieve fibroids. Symptoms include /r/n/r/n over-the-counter, OTC, medications that can help manage fibroid pain include /r/n/r/n While these treatments will not help the fibroids themselves, they can relieve fibroid pain enough for you to carry on with your daily activities. /r/n/r/n Complementary and alternative medicine, CAM, may help to treat fibroids, though the evidence is lacking. CAM treatments that may help fibroids include /r/n/r/n Prescription medications are primarily used to manage symptomatic fibroids, but they can have significant side effects. /r/n/r/n Types of medications used to treat fibroid pain and heavy bleeding include /r/n/r/n Fibroids cause pain through their bulk and weight, or by pressing on other organs and nerves. The only way to completely remove a fibroid is with surgery. There are a few surgeries and procedures that your doctor may recommend. /r/n/r/n You will need to consider your fertility goals when choosing a fibroid treatment. A myomectomy is the preferred surgical procedure to remove fibroids among those who wish to preserve their fertility. /r/n/r/n Fibroids are the most common gynecological disorder. Fibroids can cause pelvic pain, abdominal pressure and heaviness, irregular and heavy menstrual bleeding, or bowel and bladder symptoms, but your experience will be unique. /r/n/r/n Fibroids are diagnosed by a gynecologist based on your health history, symptom profile, family history, and ultrasound. Fibroid pain can usually be managed with OTC pain relievers and lifestyle additions like meditation, stretching, talk therapy, yoga, low-impact exercise, OTC medicines, TENS machines, and a healthy diet. /r/n/r/n Fibroids that are problematic can be treated with prescription medication, including antifibrinolytic agents, hormonal birth control, and GnRH agonists. If fibroids are causing severe symptoms, invasive treatments may include uterine artery embolization, uterine ablation, surgery to remove fibroids, myomectomy, or hysterectomy. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.